Hello there, my name is Kaitlin Haskins. I'm a nursing student in the Vermont Technical College ADN program, working to become an RN, and this class is LPN to RN Transition with Kat Clark. This topic and presentation is on a leading change topic regarding advocating for the use of video discharge instructions to improve patient outcomes in healthcare. So my thesis statement is this. Research has shown that amongst patients being discharged from healthcare facilities such as emergency departments, rehabilitation units, and medical surgical units, delivering discharge instructions by video, in addition to using the typical oral and written instructions, increases information comprehension and retention, and also improves patient health outcomes. We like to see that, right? This is important for a number of reasons, and it's relevant to the current industry. For one, we've seen improved patient education and outcomes, a better understanding of the disease and the process, increased efficiency in terms of staff time, and cost savings for the healthcare institution as a whole. And also, this is a modern and innovative education technique. Why don't we catch on and try something new? The majority of healthcare professionals and patients find that discharge instructions are valuable in addition to oral and written instructions. Specifically, according to one study, 96% of healthcare professionals agree that video instructions are valuable, nearly all of them. And 50% of patients who were surveyed are interested in receiving video discharge instructions. We'll find that certain populations aren't going to be interested in video instructions, however, many will be. They can watch the instructions in the healthcare facility itself, but also in the comfort of their own home. If they want to refer to the information they learned while they were admitted to the hospital or the outpatient clinic, they can refer back to the video when they're at home. So I'm going to provide you with two examples. The first one is regarding a recent study conducted in a military hospital emergency department, where they looked at 60 adult patients who were diagnosed with respiratory infections. Some of the patients were offered the standard discharge procedures, and others were offered the standard procedures plus video discharge instructions. 10 minutes after the education was provided, patients were given a 5-question survey designed to test their knowledge retention. The researchers found a significant improvement in understanding and retention of the information amongst patients who were provided with video instructions as an add-on to the standard methods. The authors of this journal concluded the evidence exists to recommend that all emergency departments consider adding video as a method of delivering patient education prior to discharge. Pretty good testimony, right? And the second example looks at a pediatric emergency room. This is regarding a recent study conducted at the Inova Loudoun Pediatric Emergency Department, where nurses evaluated the following question. Among caregivers who have discharge instructions among caregivers who have children who were discharged from the emergency department, does the addition of video discharge instructions to standard written and verbal delivery result in improved knowledge about the child's diagnosis, their treatment, illness duration, and when to seek further medical care? Their multidisciplinary team used the Johns Hopkins nursing model for evidence-based practice to guide the process of designing and testing this intervention. The team worked with 83 caregivers of pediatric patients to test their knowledge of delivery of discharge instructions, which were provided in one of two ways. Standard discharge instructions, consisting of a written printout, and verbal instructions from their provider as well as the discharge nurse, or the second, which is a standard method plus the video discharge instructions. When they were doing post-delivery testing of the caregiver's knowledge, this proved that video discharge instructions can be used by nurses as an efficient, standardized method of delivering information in a way that increases retention and understanding for pediatric caregivers. In conclusion, the evidence-based change to add video delivery of discharge instructions to the current procedure for patients leaving the emergency department at hospitals anywhere around the world can make a significant positive impact on the quality of the healthcare and the likelihood of desirable health outcomes. And last but not least, I have references to share with you. Thank you for tuning in. Be well.